Premiers are meeting tomorrow. The table, more than $46 billion over 10 years. That's of new money anyway, far short of what the provinces were calling for. I spoke with Intergovernmental Affairs Minister Dominic LeBlanc on Friday about whether this money will actually improve healthcare in this country. Minister LeBlanc, nice to see you.
Good morning, Rosemary.
How did you arrive on this amount? Because obviously it's significantly less than what the provinces were looking for. So where did these numbers come from?
The Prime Minister and the Minister of Finance had worked on what would be a significant but affordable financial commitment over a longer horizon than previous agreements had contemplated. Many of these agreements in the past had been for 5 years. We heard the provinces saying a longer horizon offered more certainty for them. And we think that this is on top of the existing increases that are built into the formula. This is very complicated, and people throw around these big numbers, Rosemary, and it's sort of like an accountant's race to the basement. The amounts of money and the billions of dollars get people confused, but there are billions and billions of additional dollars in the current formula going out for 10 years. We've increased that by, as you know, almost $47 billion additional dollars. And we think that that is a significant offer that the Government of Canada can afford at this particular moment.
Although the guarantee that you were putting into the CHT, the Canada Health Transfer, you're bumping it up to 5% as a floor, but only for 5 years. Does that mean that there would be space to negotiate after 5 years, or to talk to the provinces to see where they are at? Obviously, I don't know if you'll be in government, but would that, do you think, be the expectation of the provinces?
So, and that's a very fair point. That when I met with Premier Ford, for example, in Toronto last Thursday, he is focused, as I know other premiers are, on like what happens at the end of a 10-year period. You mentioned that the 5% increase is locked in for 5 years, a minimum of 5%. It's 9% next year, but it will be at least 5%. The average provincial healthcare spending growth, Rosemary, in the last 10 years has been a little less than 4%. So that is not an insignificant amount of money. It will be built into the base, meaning subsequent increases will be on top of that sort of compounded effect. But I told Premier Ford that, of course, we would be willing to look at in 5 years or whatever, halfway through the agreement, similar to what we did in the childcare agreements. Let's sit down, let's look at the data, look at the outcomes, how are we performing, and how are both orders of government contributing to improving the healthcare system. So
there were, no one seems to like the word conditions, but there are these things that everyone has to agree on, and if François Legault is no longer calling them strings, I won't either. But there are metrics that they're going to have to put in place in order to demonstrate how they're doing. If no one meets the metrics, what is the recourse? Is there clawback? Is it just sort of public humiliation? What happens if they don't meet those goals?
And that was a question that some premiers had put to the Prime Minister in the conversation in Ottawa on Tuesday. We told them very transparently that the most important thing that we need to do collaboratively up front is build this common data platform for the reasons you said. If Canadians want to be able to measure the results that their tax dollars are achieving, and compare one jurisdiction to another. I'm in New Brunswick. If the healthcare system here is doing much better than the system in Newfoundland and Labrador, or not as well as the one in Saskatchewan, the premiers, the provincial governments, will obviously be sensitive in front of their citizens and their voters in terms of those outcomes. We think that's the best way to drive sustained change, is to have this transparency, and then the taxpayers, the voters in each jurisdiction, will be able to see how a province or territory did in reaching a plan that they themselves elaborated. So the plan isn't being imposed by us. It's being developed by a province on these common priority areas that we've identified with them. And then those provincial governments will see how they do as compared to the objectives they set for themselves.
All right, that's a helpful clarification, certainly for me and probably for other people too. On the bilateral deals, which you are going to head out on the road, if I understand, with Minister Duclos and start to talk to provinces, they are not being done on a per capita basis, which is how typically we hand out money in this country. Why is that? And does that mean that people that say, I want a deal now, have a chance of getting more money than those who wait until the very end?
No, because the allocations in the bilateral agreements are known to each province. So somebody jumps first, like when you were kids and you're on the dock and somebody says 1, 2, 3, go. There's always some clown that would jump in the water and everybody stays on the dock laughing at them. There's none of that going on here, in the sense they know how much money is available per jurisdiction. But your point is right. We decided on building a significant base in every province. So Newfoundland and Labrador has the same base amount as does Ontario, and then the rest of the money is allocated per capita. In that comparison, New Brunswick, Premier Higgs, who I think is on your show, gets a $50 million annual base. So does Premier Ford, whom I saw in Toronto last week. He told me he thought it was important for the larger jurisdictions to recognize that the smaller provinces don't have the economies of scale. Some cases have aging demographics that can represent a challenge, but the vast majority of the funding goes in a per capita formula. That's the Canada Health Transfer and the significant portion of these bilaterals. But up front, there is an effort to help the smaller jurisdictions like Atlantic Canada, the Territories, Manitoba, for example.
Why not negotiate? That's the way other prime ministers have done it. Paul Martin would be an example. I know Stephen Harper didn't do it that way. But why not sit at a table and try to sort out between all of you what made sense? Why just arrive and say, here's what we've got?
Well, I mean, the tone wasn't at all, here's what we've got, take it or leave it. The tone was, that
depends on who you ask, Minister. I would say that. That depends on who you ask.
Well, with respect to the fiscal commitment, with respect to the financial commitment, the Prime Minister and the Minister of Finance determined that is a significant, generous amount of money over a long horizon, but not one that's irresponsible for the Government of Canada's current financial position. You know, the premiers that all sat around that table, Rosemary, on Tuesday with us, many of them, the majority of them, are sitting on surplus positions in their provincial budgets. They know the Government of Canada spent hundreds of billions of dollars during the pandemic to help provinces and territories, but more importantly, Canadians and businesses get through COVID. So the financial position of the Government of Canada now is not what it was 4 years ago. They understand that, but within a responsible financial framework, we think we've made a long-term generous offer, and now we're saying to the provinces, let's negotiate collaboratively the priorities we have in common, where you want to see increased investment around primary care, family doctors, health, human resources, mental health. You heard all these different priority areas that are frankly shared amongst all jurisdictions, in my view.
Just in 10, 20 seconds, do you think these side deals will happen quickly? Are we talking weeks, months?
We hope so. We hope to at least get to a position, Rosemary, where we can be having those detailed bilateral discussions with provinces in the next few weeks. I don't think it'll be complicated. There's no surprises. There's no traps here. We're hoping that they can be tied up in the next couple of months, because we want to be able to book in the federal budget those expenditures. And the provinces also want to know that they can count on those numbers in the budgets that they're elaborating in the next coming weeks as well.
Okay, Minister, always good of you to make the time. Thank you so much.
Thanks, Rosemary. Have a great day.